Hello, I'm Dr. Anil Raheja. I'm a consultant orthopedic and spine surgeon at Apollo Spectra Hospital, and I've been practicing for last 20 years. My main area of interest are arthroplasty and spine surgery. Ligament tears are a very common injury in sports persons. So anybody who is playing football or in any kind of contact sport, they are prone to getting ligament injuries. So what to do when a person gets a ligament injury? First of all is evaluation. Evaluation of the severity of injury. This is possible by means of clinical examination, by x-rays, and by means of specialized investigations like MRI examination. So in grade 1 sprain, when there is only a partial tear, only less than 25% of the ligament is damaged, that can be treated in most of the people by conservative means, that is by a principle of rest, ice, compression and elevation. Sometimes we put a plaster cast also to give ligaments rest, and slowly after say 4 to 6 weeks the cast is removed and patient is put on rehabilitation. By gradual rehabilitation, in 6 weeks to 8 weeks time, patient gets normal full recovery. However, if the ligament injury is severe, it will not heal itself. In that case, that needs some kind of intervention. Most of the ligament injuries in the knee, they can be dealt with arthroscopic surgery, and that's a keyhole surgery in which a small incision is made and an arthroscope is put into the joint. Then the injury is evaluated, and simultaneously, if the ligament tear is complete, the reconstruction procedure can also be undertaken in the same sitting.